Hello, my name is Anna Chan, and my collaborators are Laura Then and Manal Eusha. We are with New York City College of Technology, and we're presenting Trauma, Dental Anxiety, and PTSD, the role of the dental hygienist in providing trauma informed care. Dental anxiety is a fear of dental appointments and procedures. Post traumatic stress disorder, or PTSD, is a mental health disorder caused by witnessing or experiencing a traumatic event. It is prevalent for those with PTSD that have dental anxiety. This collaborative research project aims to examine how dental professionals can adjust their approach to provide a safe and supportive environment for patients with a history of PTSD using trauma informed care.
Starting with the methods and materials, the study called Changes in Symptoms of Anxiety, Depression, and PTSD in an RCT study of dentist administered treatment of dental anxiety tested how well dentist administered cognitive behavioral therapy, or in short, DCBT, helps adult patients with both dental anxiety and PTSD. 82 participants were split into two groups. One received standard sedation, while the other got DCBT from trained general dentists. The therapy was delivered in multiple sessions, totaling around 5 hours. Researchers measured outcomes using tools like the Modified Dental Anxiety Scale and found that DCBT significantly reduced dental anxiety without worsening other mental health symptoms. The researchers adhered to ethical considerations and participant consent was achieved, with approval from Norway's Regional Health Research Ethics Committee.
Research study number 2 is titled Dental Care of Patients Exposed to Sexual Abuse Need for Alliance Between Staff and Patients. It is a qualitative content analysis that analyzed and condensed open ended interviews of 13 individuals who had been sexually abused and found dental visits triggering. The interviews were 41 to 93 minutes long and were collected between April 2017 and May 2018.
In the final study, experiences, knowledge, and perceptions of dental hygienists in the treatment of patients with PTSD, a cross sectional study surveyed 342 practicing dental hygienists in the U.S. to explore their knowledge and clinical practices when treating patients with PTSD. A 22-question survey asked about PTSD education, patient care approaches, confidence levels, and whether they used trauma informed techniques in their practice.
Research Study 1 concluded that dentist administered CBT significantly reduced dental anxiety, depression, and PTSD symptoms over time, proving it to be a safe and effective alternative to sedation based treatment. These findings highlight the value of integrating behavioral therapy into dental care for trauma affected patients.
In research study number 2, patients expressed they were less anxious when dental care providers gave them a sense of control by explaining procedures in advance and patiently building a relationship based on trust. Contradictory disclosure and alliance formation were major themes that showed how much patients valued being heard and respected.
The final study explored how prepared dental hygienists are to care for patients with PTSD. While most felt confident providing care, over half, 58.4%, had received no education on PTSD, and nearly 48% reported it wasn't covered in their school training. Only a small number, just 11.1%, had pursued additional education on the topic. Even more concerning, only about a third said they used trauma informed practices in their work. But the study found a key difference. Hygienists who had specific training were much more likely to adjust their care to support patients' comfort and safety. Overall, while many hygienists understood how PTSD connects with dental fear and conditions like temporal mandibular disorder, it's clear that more focused education and hands on training are still needed. These findings highlight how critical it is to integrate trauma informed care into both initial education and continuing professional development so that we can provide a safer, more compassionate care for patients who need it most.
The studies together show how trauma, dental fear, and communication are closely linked. One study confirmed that CBT lowered anxiety levels, while another showed that abuse survivors felt more comfortable when providers explained clearly and built trust. The last study focused on hygienists. Most felt capable of helping PTSD patients, but over half had no formal education on it. Only about a third said that they used trauma informed care. However, those with specialized training were better able to adjust their approach. Overall, these findings point to the need for more structured education and hands-on training in trauma-informed practices so we can offer safer, more supportive care for patients who've experienced trauma.